Breast cancer screening. It's the million-dollar question. Everybody wants to know when, how, why, and I can understand the confusion. When the United States Preventive Task Force came out with their recommendations, what they failed to tell the public was that there was no breast surgeon and no breast imager on that committee making recommendations. And the American College of Radiology, the American College of Surgeons, American Society of Breast Surgeons, every different organization has a different set of standards for breast cancer screening. And what I'm talking about is mammography, because mammograms are our primary tool for screening. Mammograms don't prevent breast cancer, but they can prevent death from breast cancer when we find cancers early. Standard of care, state of the art in 2020 is 3D tomosynthesis, which is a type of mammogram that allows us to take images so that we can pan back and forth between a breast so that we can see subtle changes in densities and calcifications. So screening mammographies are typically recommended annually from the age of 40 based on the American Society of Breast Surgeons recommendations. And the reason that density is so important comes down to the fact that if a cancer, which is a white density, is in the midst of white dense breast tissue, you may not see it. Dr. Nancy Capella unfortunately died of breast cancer that was hidden in her breast, and she was stage 3 at the time of diagnosis. She started an organization called areyoudence.com, which is a really good resource to go to if you have dense breasts. And unfortunately, Nancy lost her battle with breast cancer, but she will always be near and dear to my heart because she raised the issue and she made everyone understand what breast density was about. And if you have dense breasts, in addition to mammography, you should be getting a screening whole breast ultrasound, or ABUS, automated breast ultrasound. And I liken it to Get Smart. When the cone of silence came down and they went underneath the bubble, well, it's like the cone of silence comes down on the breast and a small pad rolls back and forth on the breast and actually makes a topographical map of the breast tissue. In the midst of the dense breast tissue, which is typically white, you can see dark shadows in areas of concern. If an ABUS is abnormal, you come back and get what we call a diagnostic ultrasound, which will look specifically at that area. So the important thing about this density is that you can't change whether you're dense or not. About 40% of women are dense, which means that 40% of women, when they get their mammograms, need additional imaging. Now, if you've got dense breasts and you've got a family history, it may elevate your level of risk to a point where you might need an annual MRI. And the way we do this is we look at a test called a Tyrer-Cuzick test. It's an assessment model for risk of breast cancer. And a lot of times it's done at the time you get your mammogram. We do it in my office. We do it at our imaging center. And if your Tyrer-Cuzick risk is greater than 20% for your lifetime, you should be receiving annual screening MRIs as well. So these are things to talk to your doctor about. Raise the question. Ask your doctor, what's my Tyrer-Cuzick risk? Find out whether your breasts are dense or not based on your mammogram. And mammograms don't prevent you from getting breast cancer, but they can prevent death from breast cancer. So what we need you to do is be proactive. Know your breast, do your monthly breast self-exam, get a clinical exam by your doctor every year. And if you feel a lump in your breast, you need to raise your hand. It's like TSA. They say if you see something, say something. Well, this is TSA for your breast. If you feel something, raise your hand and get it evaluated. Because not every piece of your breast tissue is evaluated on a mammogram. There are pieces of your breast tissue that are close to your chest wall that can't get on that block. So when you're getting that screening mammogram, if something is at the bottom of your breast, what we call the inframammary fold, if it's in toward the central portion of your breast, toward your sternum, far lateral toward the axilla, or high in the above the breast toward the supraclavicular region, as we call the clavicle and the breast, that area in between, a lump can hide in there and not be seen on a mammogram. And I've had patients come in with negative imaging and they didn't raise their hand when they went for their mammogram and say, listen, I feel a lump. We can't know if you feel a lump unless you tell us. So we've got to be partners in your screening. So if you're going for your screening mammogram, know your density, know whether you need additional testing, ask about your Tyrer-Cuzick, and certainly if you feel something, say something, because that's the best way for us to be able to give you the best breast health possible.